Hello, my name is Yasmin Salamah. I am from Software Engineering and Information Science Lab from the Department of Computer Science, IPB University. I'm going to present to you about Thymun, a smart mobile health platform for the autoimmune community to improve the health and well-being of autoimmune sufferers in Indonesia. I'm with my other colleagues, Rahma, Dany, Asyifa, Tsonya, Yumna, Afifah, Fajar, Maulana, and Mr. Auzi, Asfarian. Overview of autoimmune and its condition in Indonesia. What is autoimmune? For normal people, immune system is something that protects you from other foreign objects like viruses or bacteria so you won't get sick. But for autoimmune disorder, it actually attacks the body tissue causing organ function in the human's body. Three main points about autoimmune is it is not yet curable, it is chronic and lifelong condition. In numbers, increased percentage of autoimmune cases in the world is 3.7% to 7.1% for the past 20 years, and there are 157 types of autoimmune classified, and expected number of people with lupus in Indonesia is about 250 million persons in Indonesia. Lupus is only just one of the type of autoimmune disease. From 157 types out there, you're probably familiar with diabetes type 1. It is also an autoimmune disease or rheumatoid arthritis. Number of cases and lupus death related in Indonesia is increasing. As we can see here, in 2014, number of cases is from 1,000. In 2016, it increased to 2,000, about 2,166. The number of deaths is also increasing from 200 to 50, 150, 50, 150 in 2016. The methods that we are using is the prototyping method because we are dealing with a different user with different variety and different types of disease. Also from the perspective of health professional, so we think that it can causes a lot of requirements and different kind of requirements. So first of all, we are doing requirement analysis from every user. Then we design the interface and design the system that is suitable for each user. Then we are going to prototyping it. Then we ask for their evaluation and refine, and it's iterate with different user. When every user that we already ask is pleased with our product, then we develop the end product. Then we test it. Then we release it. Um, from the requirement analysis, everyone who has autoimmune says it negatively impacts their quality of life and it negatively impacts their productivity. Their goals and needs, the first is the social needs. They want to be understood for their position and pain experience. In Indonesia, it still has a very low awareness of autoimmune, so they kind of feel secluded, and they hardly tell to everyone or their employer about their condition. They want to have a collaborative community where they can talk about their condition or disease or symptoms they are having recently. They want to have a place where they could open up their condition. And the second one is nutrition and diet. Food plays a big role in disease management, and knowing which food is great, having a great relationship with the disease is great for the patient, and to know which active ingredients is actually harmful is also plays a big role too for disease management. So they want to know that what kind of foods are included in their diet now, and they want to know which ingredients in food they consume. They want to know whether it is dangerous for their disease or whether it's actually good or whether it's neutral. And they want to know the recipes for homemade cooks that is suitable with diet plan. The third one is brain fog. So in autoimmune disease, your immune system actually attacks your own brain, and it can causes a cognitive impairment. It makes you uh, hardly retain information for all the time. It also kind of makes you a little bit depressive, uh, and then they need that they want to have this uh, they have this need that they want to remember the agendas of the days ahead, so they want missing out, and they want to retain information for a longer time, and they want to manage and monitor their emotion journey. The fourth one is health digitalization, and this is one of the biggest demand actually among our users. They say that when in Indonesia there has no integration of medical records, so when they go to a new hospital they need to start from zero or something like that, because there is still no health digitalization in here. So they want to have doctors can determine trend of patient symptom development from previous visits, and patient can record their symptoms daily, and digitalization will result in paper ways of consultation, because you need to know that when a patient with autoimmune actually goes to doctor about 2 weeks to 1 month every time, and they take lab result, they take uh, other documentation of their disease, and it can causes it results in a lot of paper mistakes that they need to carry around, and it is very ineffective. So our philosophy in building Thymun is based on paradigm smart health communities and the future of health by Deloitte as ICoICT2019. The first functionality is empower proactive health and well-being management. Second is foster a sense of community and well-being. The third one is enabled by digital technology and behavioral science. The fourth one is meaningfully use data to improve outcomes. And then we create a Thymun and enable new innovative ecosystem. The first one is health tracking feature. Since its disease can actually attack everywhere, it can causes a lot of different symptoms, and different disease means different symptoms too. So they want to have this like a journal of symptoms where they can update their symptoms daily for their pain scale and the intensity of symptoms perceived. There is also lab results update, because every month you need to get a lab test. It can causes a lot. It can results in a lot of paper stack, as I was mentioned before, and they want to actually update it every time they got the result from the lab test. Uh, so it can has so this app can actually contain lab result update and is personalized following the patient kind of autoimmune. And then trend analysis from the previous symptoms update and lab results update. We visualize it in trends way, so doctors can see the progression of symptoms and lab result given the previous inputs, and this is can be a data for disease progression, or whether that medicine is actually what or specific medication that doctor give is actually working for them. Mood and daily journal is helping to record every notable activity in chronological order based on user input. They can input their mood and list to do and a feedback of mood history. For example, if they have like this continuous 5 days of being sad or 7 days of being sad, then our application will give a feedback whether they need something, or what happened to them, or do they need a community to help them, or do they need a professional to actually help them. Community, so they can post and comment and like other users. Also it has category types based on the category of the post. Probably if you want to talk about medication, you can go access medication. If you want to talk about your disease, you can go to disease category, and so on. Healthy diets. So we want to make a behavioral correction of diet, and we are going to make a homemade recipe based off that correction of diet. And we want to track allergy, because people with autoimmune disease usually has allergy, and so to have what kind of foods they must know have is and to present it in a homemade recipe helps them to kind of filter which kind of foods they can take. The fourth one is medicine as supplement, which medicines and supplement they take. We are using drug bank APIs for this. And the fifth one, BMI, is to track their calorie consumption. In home, we have community, so meetups in with community of autoimmune Indonesia. We also have vital health monitoring, so we are using Google Fitbit API. So if you have Fitbit or any kind of smart health band, I think Thymun works also for this. You can use it and connects to our application. So our application actually knows our current heart rate or steps and other things that is can measured by fitness band. There is also news around autoimmune and education modules for people which levels levels respected. So when you newly have autoimmune, you begin in level 1, and then and it goes on as you progress yourself in the disease. Okay, so we make it into user and spread to max. After every user use our application, their remarks is this is from a multiple autoimmune syndrome user, and this is actually she consented to be mentioned in our presentation. She's actually the chairman of autoimmune community in Indonesia, and she is also a physician and embraces in immunology. She says that most people with autoimmune is in critical needs of a social platform in which they feel understood. And the second one is from internal medicine and immunology doctors. She says that it helps for patients to be able to note the progression of their symptoms and note then their current medication intakes. The third one is pediatrician. She says that disease education is important for caretaker to be able to understand how the disease progress and the patient condition. This is she also considered of being mentioned in the presentation. She's actually a BBC journalist from United Kingdom, and she's one of the biggest activists in chronic illness. She also has SLA, which is systemic lupus erythematosus. She say that autoimmune is still believed as uncharted areas in the eyes of society. Low awareness causes people with autoimmune feel secluded. The second one is also someone who has lupus, SLA actually. She says that in Indonesia there are almost no digital records in most hospitals and no integrated medical record at the national level. The third one is someone who has rheumatoid arthritis, which is a student. She says that it is crucial for people with autoimmune to address their issue in brain fog. Dietary control is also a major part in disease management. And the fourth one is a student too with myasthenia gravis, an autoimmune that causes its neuron. She says that symptoms progression is believed to be the key to therapy management and then leads to disease control. The conclusion. So the conclusion is the four main user needs of autoimmune sufferer is the first one is social needs, the second one is brain fog, the third one is nutrition and diet, and the fourth one is health digitalization. And these four keys is implemented in our product, which is Thymun, as we want to make people with autoimmune have this platform where they can get four of these solution of their needs. That's all from my presentation at ICoICT 2020. Thank you.